Okay, Joe, I've started your IV. Everything looks good. No signs of phlebitis, no red, warm, tender spots, no signs of infiltration, no cold, swollen areas. The IV looks like it's flowing just fine. Now we're going to go ahead and get the antibiotics started that your doctor wanted. He ordered cefotraxone. A safe dose is 1 to 2 GMs. Indications: treat serious lower respiratory tract infections, urinary tract infections. We're going to use this today to treat your pneumonia. Dilute 1 GM with 10 milliliters of diluent. Rate of admin is 1 dose over 30 minutes. Precaution is hypersensitivity can occur. Check history of reaction to penicillin or other allergens. You've never really had an allergic reaction, so I'm not too concerned about that today. Side effects are diarrhea, dizziness, headache. I will monitor you for those. Related diagnosis is aplastic anemia. Antidotes: discontinue the medication, give fluids, an electrolyte, and a protein supplement if you were to have a reaction, but I'm not worried about you reacting to this at all today. The rate we're going to be giving it is 50 mLs per minute, which equals out to be about 12.5 drops per minute. 50 mLs per 40 minutes. I don't know if I said that right. So 12.5 drops per minute. Okay, so what I'm going to do is I'm just going to make sure I have everything here. I'm going to check the integrity of my cefotraxone and check the integrity of my tubing here. Everything looks good. I'm just going to double check this, do my first check with the MAR. It's cefotraxone, second check, cefotraxone. And then the 5 rights are right patient, right drug, right dose, right time, and right route. And then I'm going to do another check. Cefotraxone. So I've done my 3 checks. Everything is good there. Now I'm going to start by putting on some gloves, and I'm going to get this started for you. Okay, I'm going to go ahead and open up my packaging here. I'm going to start by making sure my clamps are closed on my tube. And then I'm going to lower our solution here. Okay. Using a sterile technique, I am going to take the caps off and I'm going to connect my tubing to my medication. So once the caps are off, I won't touch what's underneath either of these. Using the thumb-to-thumb method, I'm going to push and twist without touching either until these are connected. Okay, and I'm going to hang this up. Okay, now what I'm going to do is I'm going to take an alcohol pad and I'm going to clean the first port on my main line. I'm going to clean this for 30 seconds. 1, 2, 3. Okay. And now I am going to take the top off here. This is sterile under here, so once I take this top off, I do not want to touch. Connecting these two very carefully without touching. Okay, those are connected. Now what I'm going to do is I'm going to bring my medication lower than my IV bag, and I'm going to open it up to prime the tubing. Okay. I'm priming the tubing, getting all the air out of the tube. Okay, and I'm going to clamp this again, bringing this up here. Okay, and then to do the drop rate, we want 3 drops per 15 minutes. So I'm going to open this up, And then I'm going to control the drop rate with this main control. I'm going to do 3 drops per 15 seconds. Okay, we're at 3 drops for 15 seconds. It says open, it is infusing. My line is good, that looks good, no sign of infiltration. It is going into your vein there. Everything is good there. Now I'm going to label my tubing. I have my name, time, and date on this label here. Okay. And then I would document that I have started the antibiotic. Now what I'm going to do is I'm going to demonstrate how to remove the IV. I'm going to start with washing my hands. I would make sure that there is something to protect the linens underneath. We already have that tacked here. So I don't need sterile gloves. I'm just going to use my clean gloves. Apply clean gloves. Okay. Okay, so first I'm going to remove the tape that is holding down my IV. Then I'm going to get a piece of gauze ready, and as soon as I remove this IV, I'm going to apply pressure right away. So I'm just holding it over top of it, being careful not to apply pressure until the IV is out. I would slip the IV out and hold down pressure. I would hold this pressure for 2 minutes. So after the 2 minutes would pass, I would then grab a sterile piece of gauze, replace that, and I would take down the sterile piece of gauze. Okay, and then I would document everything that I have done. Joe, is there anything else I can help you with? I have time. Okay, thank you.